Hi everybody, this is a quick video about two of my favorite topics, methylene blue and red light therapy. So methylene blue, for anyone who doesn't know, it's this fantastically interesting molecule. Methylene blue has the strongest antioxidant capacity of any molecule out there, to my understanding. It has kind of this like self-regenerating antioxidant property to it. So most antioxidants, once they're used up, neutralizing a free radical, they're kaput until they're kind of reactivated, if you will, by some bigger, stronger antioxidant or some enzyme or something that does that in the body. Whereas methylene blue is this kind of self-perpetuating antioxidant. So as long as it's in the body until the body eliminates it, it has this really strong antioxidant activity. Methylene blue also has been shown to have some antiviral properties, and it's good for mitochondrial function and a whole bunch of other things. So really, really cool molecule. Red light therapy is something where folks can use either red light as a laser or as a LED light. Oftentimes it'll be combined with infrared light, and red light has its own benefits from stimulating mitochondria. So the photons from the red light actually get absorbed by certain components of the electron transport chain in the mitochondria. So it's literally infusing electrons into the electron transport chain. So it's literally putting energy into those little organelles in the cells, which just endlessly cool stuff. And in addition to that, it helps to improve our microcirculation, has anti-inflammatory effects, can stimulate tissue healing effects. So red light, also good. So what's really cool is when there's methylene blue in the body, so in the bloodstream, and it contacts it, and it's contacted by red light, it has this amplifying effect. It basically creates this oxidative burst, which ultimately can give a significant antimicrobial effect to the body and kind of help to play. It kind of plays off. They play off of each other. So if folks have the, and as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only, and if you need medical advice, please talk to your healthcare provider to obtain that advice. But if folks are working with methylene blue and they're exposed to red light therapy at the same time, then we get this, additional benefit in terms of this oxidative burst. And then we also get kind of this synergistic benefit between the two different therapies because they're both working in, sort of similar complementary ways. So how can that be combined? Well, a person could take oral methylene blue, and then that gets into their system, and then they might work with a red light panel or whatnot, or they might use intravenous methylene blue, which is something that we do here at our clinic, and it's kind of crazy as it looks like basically blue Kool-Aid in the IV bag, running in, and that can of course get the blood levels up, to a significantly higher level. Not everybody has access to IV therapy, but it's something that can be used. And then another way of accessing red light, as I mentioned, is through a laser. So that could be through topical red laser, or there are actually intravenous red lasers that can be used. And so an intravenous methylene blue plus intravenous red laser, to my understanding, would be one of the strongest ways of accessing kind of the benefits of both of those therapies. Again, not something that everyone can just do at home, but if it's something that someone was finding benefit from, they might use the oral treatment at home along with, say, a red light that they have at home, or maybe using that at a clinic, and then maybe from time to time they'd be able to do the intravenous route to kind of get that extra oomph. I recently spoke about or discussed methylene blue and red light therapy with one of my podcast guests. If you aren't aware, I have a podcast. It's called the Overcoming Chronic Illness Podcast. I haven't yet published this episode yet, but I was chatting with someone named Carrie Bennett. Carrie Bennett has a really great Instagram page. Her handle is Carrie B Wellness, so just Carrie, Carrie, the letter B, and then wellness. So please check her out. She has lots of great information, talks about way more than just red light and methylene blue, but that part of our conversation was around that and a bunch of other great things too. So if you're interested in more information, she's a great resource, and there's other great resources out there as well talking about these two topics. So I hope that this was of interest. If you have any questions about this topic or anything else, just post in the comment section below, and I'll do my best to answer as soon as I can.